Good afternoon. My free paper on amniotic membrane as a wound modulator in trabeculectomy. Trabeculectomy is the procedure of choice as a surgical treatment for lowering the intraocular pressure by creating an artificial drainage from the anterior chamber into the subconjunctival space. The success of which is primarily linked to the subconjunctival fibrosis, which is prevented by the existing agents like mitomycin C and 5-fluorouracil. But they have complications which have been well established, which is the following. Amniotic membrane, it inhibits fibrosis by downregulating the transforming growth factor beta. It provides a framework and basement membrane for the filtering bleb, and muted healing responses present. The objectives primary being to evaluate the efficacy of amniotic membrane transplantation in trabeculectomy, and the secondary being the outcomes and complications that are seen. The study design is a prospective longitudinal interventional hospital-based study where 30 patients with primary glaucoma were included. Inclusion criteria, primary glaucomas which are uncontrolled and they have a rapid progression, and exclusion criteria being secondary glaucomas. The methodology, a partial thickness rectangular flap of 2 into 2 mm was raised, and if it was a combined procedure, a linear incision temporal to it was taken. Anterior chamber was then maintained with air after paracentesis. Sclerostomy was performed with Vannis scissors, and the scleral block was excised using Kelly sponge or Vannis. The scleral flap was then sutured with 10-0 nylon. 4 into 4 mm amniotic membrane was cut and then placed over the scleral flap, and the conjunctival flap was sutured with 8-0 Vicryl, and stromal hydration and subconjunctival injection of Genta plus dexamethasone was given. Post-operatively, the patient was followed up for 3 months where visual acuity, post-operative IOP, and slit lamp examination for the bleb characterization was done based on move fields. So the results, the age range of the patients were 50 to 82 years, and majority were in 61 to 70 years. 24 were primary open angle glaucoma, 5 were normotensive, and 1 was primary angle closure glaucoma. The IOP seen was at the end of 3 months, 43.3% reduction was seen with a p-value of less than 0.001. So it was significant. So the bleb characterization is as follows. Moderately elevated blebs were around 50%, and 53% showed mild vascularity, 80% had a central bleb area of 25%, and 53% had a peripheral bleb area of 25%. The complications encountered were hyphema, subconjunctival hemorrhage under the bleb, the incomplete peripheral iridectomy during surgery, and posterior capsular rent, toxic anterior segment syndrome, which did not show any long-term, which were managed and did not show any long-term complications. The outcomes being complete success of 25 patients, 83.3%, and qualified success of 17%. Discussion. Stavika et al. Compared two groups, that is amniotic membrane versus conventional.
Time is over.
Yes.
Time is over, actually.
Shall I just wrap it?
You can continue in finishing it,
Yes,
but you've exceeded your time.
Yes, ma'am. Amniotic membrane of the study group showed diffuse with mild vascularity, and the control group showed a flatter vascularized bleb. The Eliza et al., which had mitomycin C plus amniotic membrane in the study group, showed thin avascular blebs, and 62.5% showed flat vascularized bleb in the plain MMC group. So the intraocular pressure in these studies were not significantly different. The conclusion is the present study says that amniotic membrane transplantation is both safe and efficacious, and the reduction in IOP is clinically significant, with showing diffuse mild vascularity at the end of 3 months having total success.
Thank you. Just one question that
Yes.
There was no control for this, right? Control arm.
It was an interventional longitudinal study of 30 patients, ma'am.
Okay.
It was not an RCT.
Okay.
Okay, let's move on to Dr. Surbi.